Nurse Aide Practice Written Exam. Question 1. A resident is learning to use a walker. The nurse aide should: Option A, stand behind the resident. Option B, walk on the resident's weaker side. Option C, encourage the resident and provide support as needed. Option D, tell the resident to practice alone. The correct answer is option C, encourage the resident and provide support as needed. Question 2. When applying a transfer belt, it should be placed: Option A, over bare skin. Option B, around the chest. Option C, around the waist over clothing. Option D, around the knees. The correct answer is option C, around the waist over clothing. Question 3. The Omnibus Budget Reconciliation Act, OBRA, requires nurse aides to: Option A, complete at least 75 hours of training and pass a competency exam. Option B, have a college degree. Option C, work without supervision. Option D, administer all medications. The correct answer is option A, complete at least 75 hours of training and pass a competency exam. Question 4. The correct sequence for donning PPE is: Option A, mask, gloves, gown, goggles. Option B, gown, mask, goggles, gloves. Option C, gloves, gown, mask, goggles. Option D, goggles, gloves, gown, mask. The correct answer is option B, gown, mask, goggles, gloves. Question 5. The nurse aide is assisting a resident with a weak right side to transfer from bed to wheelchair. Where should the wheelchair be positioned? Option A, on the right side of the bed. Option B, on the left side of the bed. Option C, at the foot of the bed. Option D, directly in front of the bed. The correct answer is option B, on the left side of the bed. Question 6. The nurse aide is preparing to give care to a resident. The first action should be: Option A, gather all supplies. Option B, explain the procedure to the resident. Option C, put on gloves immediately. Option D, close the privacy curtain. The correct answer is option B, explain the procedure to the resident. Question 7. A resident tells the nurse aide they feel dizzy and weak. The nurse aide should: Option A, tell the resident to stand up slowly. Option B, have the resident lie down or sit, stay with them, and call for the nurse. Option C, give the resident salt tablets. Option D, tell the resident they are fine. The correct answer is option B, have the resident lie down or sit, stay with them, and call for the nurse. Question 8. Passive range of motion exercises are performed. Option A, by the resident without assistance. Option B, by the caregiver moving the resident's joints. Option C, by the resident against resistance. Option D, only by the physical therapist. The correct answer is option B, by the caregiver moving the resident's joints. Question 9. A resident who is terminally ill tells the nurse aide, "I'm not afraid to die. I've lived a good life." The best response is: Option A, don't talk like that. You're going to get better. Option B, it sounds like you've made peace with things. I'm here to listen. Option C, change the subject immediately. Option D, you shouldn't give up hope. The correct answer is option B, it sounds like you've made peace with things. I'm here to listen. Question 10. The most effective way to prevent the spread of Clostridium difficile, C. diff, is: Option A, alcohol-based hand sanitizer. Option B, soap and water hand washing. Option C, wearing a mask. Option D, using the same gloves for multiple tasks. The correct answer is option B, soap and water hand washing. Question 11. Which position is correct for a resident with difficulty breathing? Option A, supine, flat on back. Option B, Fowler's position, sitting up. Option C, prone, on stomach. Option D, Trendelenburg, feet elevated. The correct answer is option B, Fowler's position, sitting up. Question 12. Which task is outside the nurse aide's scope of practice? Option A, taking vital signs. Option B, providing a bed bath. Option C, inserting a urinary catheter. Option D, assisting with ambulation. The correct answer is option C, inserting a urinary catheter. Question 13. The nurse aide notices a reddened area on a resident's sacrum, tailbone. The first action should be: Option A, massage the area vigorously. Option B, apply heat to the area. Option C, report to the nurse and keep pressure off the area. Option D, apply an ice pack. The correct answer is option C. Report to the nurse and keep pressure off the area. Question 14. The best time to collect a urine specimen is option A. After the resident has had breakfast. Option B. First thing in the morning. Option C. Just before bedtime. Option D. After the resident has exercised. The correct answer is option B. First thing in the morning. Question 15. The nurse aide observes a resident using their call light repeatedly throughout the shift. The nurse aide should option A. Ignore the call light after multiple calls. Option B. Assess the resident's needs and report changes to the nurse. Option C. Remove the call light. Option D. Tell the resident they are being a burden. The correct answer is option B. Assess the resident's needs and report changes to the nurse. Question 16. A resident with dementia says, "I want to go home. My children are waiting for me." The best response is option A. You live here now. Your children put you here. Option B. You can't go home. This is your home. Option C. Tell me about your home. What do you like best about it? Option D. If you behave, maybe your children will visit. The correct answer is option C. Tell me about your home. What do you like best about it? Question 17. A resident refuses to take prescribed medication. The nurse aide should option A. Force the resident to take it. Option B. Crush it and hide it in food. Option C. Report the refusal to the nurse. Option D. Throw the medication away. The correct answer is option C. Report the refusal to the nurse. Question 18. When dressing a resident with a paralyzed right arm, the nurse aide should option A. Dress the right arm first. Option B. Dress the left arm first. Option C. Dress both arms simultaneously. Option D. Leave the right arm undressed. The correct answer is option A. Dress the right arm first. Question 19. A resident states they are in pain. What should the nurse aide do first? Option A. Tell the resident pain is normal. Option B. Report the complaint to the nurse immediately. Option C. Give the resident pain medication. Option D. Ignore the complaint if vital signs are normal. The correct answer is option B. Report the complaint to the nurse immediately. Question 20. The nurse aide notices a resident seems unusually withdrawn and sad. What should the nurse aide do? Option A. Assume the resident is just tired. Option B. Report the change in mood to the nurse. Option C. Tell the resident to cheer up. Option D. Avoid the resident until they are in a better mood. The correct answer is option B. Report the change in mood to the nurse.